Hello and welcome again to Whole Body, Whole Health. This is the series of the different senses. We're calling it Sense Your Health. And today's session is on the sense of taste, what we assume to be the most important sense in our body as far as food goes. So just to get some things started, our mission as is to enhance and promote good health and well-being through research, education, and services in food science, nutrition, and dietetics. These are some of the wonderful partners we have in the community. And presenters today will be myself, Shelly Salemia, as always, the registered dietitian. I'll be talking about the nutrition portion, educating you out on nutrition and health and food and the different senses. And then Janika will be leading our really cool activity. So just to get some things out of the way, some general housekeeping, we welcome all comments and questions as usual. Just try to put them in the chat box for now or the Q&A section, and we'll get to it after the presentation. And you can try to write them down if you forget, or just put it in there. And then we'll see them and speak them out loud. But if you do have a specific question that's more medically inclined for you, then we're going to have to refer you to a medical provider or a registered dietitian to answer that question. So the objectives for today, what we're going to learn about how our sense of taste affects our health. We're also going to talk about how our taste buds and the gustatory system, which we'll get into, how it works and how it relates to the entire body, and also how to manage changes in taste, which can happen during cancer treatment and the whole process. Taste buds. What do you think when you see this picture, right? You can actually see the little prickles. You can see everything on her tongue. This is the tongue. This is what we taste with. This is our mouth. Everything here is involved in taste. But our tongue and different parts of our tongue are able to sense different things in the taste. So they say the back of the tongue is able to detect bitter flavors, the sides are for sour flavors, the sweet is kind of in the middle almost, but in the front, and salty is at the tip. And then the umami taste buds are all over the tongue, but more in the middle. And umami is basically savory. So think steak or something like really like makes your mouth water, meaty, something like that. But what we didn't learn this in school is that the taste buds are actually kind of not as specific as we thought like this. Like we always said, this is exactly where the taste buds are located and that's it. But in reality, it's kind of more mixed. It's more all over the place, and the taste buds are able to pick up on different flavors, but it's a little bit more complicated than what that chart had showed. So, but in generally speaking, we have this ability to taste sweet. We have taste buds that can taste sour. We can detect salty, we can detect bitter, and umami. So there is something to that. Our tongue does have these certain taste buds on them that can detect these different flavors. And they do have locations on the tongue, all over the tongue, but they're sometimes concentrated in specific regions. And so this is the taste buds system, as you can call it. In technical terms, scientific terms, it's called the gustatory system. And so without getting too scientific, too much into it, there is a part of our brain, which they're calling it the gustatory cortex, that is able to get those signals of the certain taste. So when you taste something, it's going to that place. And it's also controlled by the thalamus, a different part of the brain, which goes down to the medulla oblongata and then to the vagus nerve, which we talked about last time, the vagus nerve with relaxation, calm, our senses that we're not able to fully control, which are then sent signals from the different nerves in the face and also different nerves in the tongue. So glossopharyngeal. So glosso is a scientific word for tongue. And pharyngeal is kind of like in the back. It's kind of where our throat is. And so there's these nerves that actually pick up on the flavors. So that's something we don't actually realize, is that our taste buds are coming from nerves, but you don't think about it. You know, you touch yourself and you hit it and you can feel that. That's your nerves that's sending the signals to your brain. Likewise, our taste buds are picking up on these signals, and through the nerves, it's sending it to the different parts of the brain. And in return, our brain sends a signal: this is what I'm tasting or feeling or experiencing. And so when we're tasting, our brains are sending signals to continue or to stop eating certain foods based on the flavors that we're experiencing. So if you taste something really good, your body, your mind tells you, keep going, keep eating this. I'm sure we've all experienced this before. Or if something tastes really bad, our minds send us the signal, say, stop, no more. And so if we didn't have the ability to really taste food, if we weren't able to enjoy the food that we're eating, we would have a pretty hard time eating enough every day. So oftentimes people say, oh, I wish I didn't like food so much. I eat too much. But if you can think about it on the other side, if you're not tasting food at all, it's going to be hard to eat, because our taste buds are sending signals to our brain to continue to eat more, which is very important, as we'll see. So sometimes during treatment, cancer treatment specifically, with certain chemotherapies, it can cause a change in our taste buds. So suddenly food can taste metallic out of nowhere. Foods can just, what you used to love, now it just tastes really bad. You possibly just don't like it anymore. Or on the flip side, you just don't have that much taste. You have a diminished taste or a loss of taste. So you're not really tasting so much. And on this image here, you can see that there is a lot more going on with taste. So it's not just the tongue that's happening. If there are changes going on, it could be, what's going on through our nose, through smell, which we're going to talk about in a different session. We're going to also from like what we hear, which we talked about last session, touch, which is physical from our mouth, and also how it looks, and the tastes. So all these things really are combined in order to eat, and all the signals and encouraging us to eat or to not eat. But taste is a major part of this, which is what we're talking about today. And so changes in taste has kind of like an umbrella term called dysgeusia. And sometimes this dysgeusia can be accompanied or followed, or has a combination by dry mouth. The technical term is xerostomia. So sometimes dry mouth can cause a loss in taste, or sometimes it's a combination of things, that what's causing the dry mouth is also causing the loss of taste. And basically, this can be caused by certain medications, certain chemotherapies, even radiation therapy, if you're getting it near your face area, head and neck. Sometimes even inflammation can cause those changes. Nutrition deficiencies is able to cause change in taste. And sometimes even metabolic disorders or viral infection, as I'm sure you guys have heard, that the COVID-19 virus was able to cause a loss or a change in taste. And sometimes even a loss of smell can cause a loss or change in taste. So as we just showed in this last slide, is that the different senses are related together. And sometimes if you can't smell, you can't taste. And maybe you've heard that before. Maybe you've had a cold and you couldn't smell at all. You're all plugged up, and then you can't taste anything. So you just have chicken soup and that's it. So it is related to the smell as well. What you're tasting is related to what you smell. But we're going to get into that in a different session. And so there are ways to actually manage this this change in taste and the loss of fluids in the mouth or dry mouth. And there's different methods to really help with that. So for a lack of taste, meaning that you don't have any taste at all or not much taste in what you're eating, it's actually helpful to add lemon or something citrusy or vinegary, something acidic to your foods to help you be able to taste the flavors more. But let's say foods are now tasting bitter. You can actually adjust that by adding sweeteners, something sweet, even honey. Anything kind of sweeter, but honey is natural. It's recommended for a lot of people to help enhance or change the bitter flavor so it's not as bitter tasting. And also if you have it in like a cold temperature, so you can keep it in the fridge for a little bit or in the freezer for some time, add ice, or even if you can try to have that food at or drink at a room temperature, sometimes that's helpful for the bitter flavor. And this is also up to preference, it's also up to trial and error to see what works for you, what works better, what helps with the bitter flavor or the bitter taste. For foods that have too strong of a taste, it's just too powerful, which can happen. I think this even happens for pregnancy sometimes. Trying bland foods is an option. And so bland foods means trying to really, really limit the amount of aromatics, seasonings, try not to add flavors, these flavors that we're talking about now. So bland foods would be like white rice or any kind of really brown rice would be as well, but just no adding any salt or any flavoring to it, no seasoning, spices, herbs, nothing like that. Even just white toast, anything like pudding, but without a flavor, applesauce, anything that you can think that's just like really just mild, bland would be helpful if the flavors are too strong. So you're really trying to limit the amount of flavors that's happening in there so that it's a little bit more tolerable if it's too strong for you. And so if the food can taste too metallic or sharp, maybe kind of like iron almost, then it's helpful to add some kind of fat component to it. So like some butter, margarine, avocado, mayonnaise, something that has some kind of fat inside. And if you add a little bit of salt on top of that as well, that can really help with that metallic-y, sharp flavor that might not be really nice to taste. And so if we can say this again, if the flavors are too strong, you can try the bland foods in general. And with the bland foods, you can have starchier foods, like we said, the pasta as another example, like just plain pasta with butter, or just any kind of rice without much flavoring or salt added to it. Any kind of really plain bread that doesn't have too much flavor, or even just potatoes. Any kind of way, boiled, mashed, the oven, roasted, however you like it. It's again a trial and error thing. And so there's more examples over here. So you can even have eggs or cheese, certain types of cheese like cottage cheese, cereals, pudding, custard. There's different ways that you can really make it just bland, I guess, in general, which is usually counterintuitive to what we say. But these certain foods are less likely to change their taste or to have a strange taste compared to foods that have a more distinct or unique flavor, for example. And so if there's any or all taste changes, are some things that you can do to help as well on top of these different changes we just discussed. So you can actually swish and swallow or spit just sparkling water, carbonated water without any flavoring in it. And you can do this before, during, or after a meal. So let's say you're ready to sit down for a meal and you know that the taste is kind of changed and you're not really liking it. You can pick up your sparkling water. You can see here. Drink it and then eat. And you can do it after the meal, during the meal. And if you don't want to swallow after swishing it, you can always find a little sink or a cup to spit it out into. You can also marinate the foods into different flavors. So that's really helpful. if you marinate it in a kind of sauce that you really enjoy, if you needed the fat, for example, with the salt, then you can put olive oil, let it sit in there for a while. Or if you're finding that there's a specific flavor that you really like all of a sudden, whereas the only thing that's tolerable for you, then just marinate your foods in that flavor, and that would really help you accept that food. And there is something called a fast technique to help improve the flavor of foods. So it's kind of like you can sandwich these. So there's a fat, extra virgin olive oil, lemon juice as the acid, the A. The S is the sea salt, and then the sweet is maple syrup and grade B organic maple syrup. So that's something that was recommended for cancer patients that can help with enhancing flavor or improving flavor. And it's easier to remember. It's FASS. So you can think F is fat, A acid, S salt, and S sweet again. And these are some options that you can do in order to do the fast technique for flavor improvement. And so when you have these changes in tastes, it is a good opportunity to really experiment with your cabinet, your spice cabinet, for example. So try different herbs you've never tried before that's sitting in the back of your cabinet, different spices, even some interesting flavors you never thought about trying before. It's a good opportunity to see if you tolerate or if you really like something, if you're finding these changes in your taste that you just aren't really enjoying so much anymore. And then some people ask about spicy or hot peppers, and that's only if you really tolerate it. It's not for everybody. It's not going to automatically make the food taste better for you. But some people really enjoy spicy food. So recommend to only add in the spiciness if you enjoy it, but it's not going to help change your taste. And another really important thing with tasting is to stay hydrated. So water is super, super important for tasting. I don't know if you can even picture this, but imagine if you're so thirsty, if you don't have any water in it's just like you have a dry mouth, for example, with this xerostomia, then being hydrated is really going to help with that. And on top of that, if you are experiencing this dry mouth, and staying hydrated and constantly, keeping water with you, making sure you're drinking enough in the day is going to help with combating that dry mouth. And so another way to really help with the dry mouth is to suck on like a hard candy or any kind of mint. Imagine like at the restaurant, they have that bowl of stuff, you just grab some, so you suck on it at the end of the dinner. Or you can do it even before in this case. Or just keep some in your bag, and do that. Or even a sugar-free gum can help. So chewing on the gum can help activate those salivary glands to get the, dry mouth, to help salivate, to help get saliva to really lubricate your mouth. And don't forget about mouth hygiene. So making sure to brush your teeth after every meal if you are experiencing this dry mouth, flossing regularly, and also going to your dentist. So mouth hygiene is not only just brushing and flossing, but it's also making sure you go to your dentist appointment whenever the dentist has recommended. Because not only are they cleaning and making sure everything's okay, they're just making sure there's no cuts, specifically mouth sores. They'd be able to see that and help you out in that case. And if you do notice that there are cuts or sores, it's really important to seek treatment in order to help with that, because you don't want to have those sores or cuts in your mouth all the time. And so if you do have mouth sores and you are seeking treatment currently, and so mouth sores can happen sometimes with certain chemotherapies or certain treatments for cancer. So it is important to talk to your medical team about that. But in the meantime, while you're dealing with the mouth sores, it is helpful to avoid acidic foods or acidic flavors. So in order to help with if there is anything acidic going on, or even just to help coat those mouth sores so it's not as painful, You can add a little bit of fat, and they recommend olive oil. Remember the fast technique we talked about, and also a little bit of sweet flavoring, the maple syrup, and that can help with coating the mouth sores. The fat creates that coating action, and it can even soothe over the sore so that when you chew and swallow, it's not as harsh. As well, the sweet stimulates the taste buds to help with boosting the appetite. So they find it's a very helpful combination in that sense. As well, if you're having mouth sores, it could be really difficult to swallow, difficult to eat in general because of pain. So drinking your calories is recommended because liquids is not as difficult on the mouth and throat. So if you can get in your calories from smoothies or any kind of protein shake or any kind of protein drink in general, think like Ensures, Boost, something like that, or Gain, can be really, really helpful in these instances to make sure that you're getting enough nutrition even when it's really hard to chew and swallow. And the mouth sores can actually be treated. So you don't have to have these mouth sores just because you're going through treatment or because of your medication. So there's so many different medications out there now, which is really great. And so if you are experiencing any kind of problems, especially with mouth sores, it's very, very, very important to tell your provider so that you can even just change the medications. Sometimes people are afraid to change meds because they think it's the most effective, but the doctors, the care team knows, oncology especially team knows what's more effective than the other. And so sometimes it just comes down to side effects, and everybody can have different side effects because everybody reacts differently. So one medication might not cause mouth sores for someone, but it does for you, or vice versa. And so just talking to them and telling them that's what's happening, and then they can change your medication. And you can have something that's just as effective that's not causing this really negative side effect. In another sense, as we just talked about a few slides before, is that changes in taste can actually be caused by nutritional deficiencies. So if you're not eating enough, that can cause change in taste. So just even being able to correct those nutritional deficiencies by consuming enough vitamins, minerals, and energy and everything you need in a day can help with the change in taste. And so there is a certain condition from the mouth sores called oral mucositis. And so if you are having these mouth sores or ulcers, which can be caused from certain medications, it is important to avoid hot foods or hard foods. So we said having those liquid calories is really helpful, as well as the other methods we talked about before, having soft or bland foods. And the bland foods, like I just put it here again, it's like the oatmeal, it's the cottage cheeses, ricotta, yogurt pudding, something like mac and cheese even, mashed potatoes, these kinds of things, Jello, something that's just bland, easy, soft, that's not going to be sharp and have edges that really hurt those ulcers. Medicated syrups are out there that maybe you're not aware of. So it's like you can just put in a spoon and swish your mouth, and it's like a medicine that helps coat the mouth, easier to chew, swallow, even liquids. And then you can definitely ask your provider about this. It's called L-glutamine. It's a supplement, so it's not even medication, and you can buy it over the counter, any kind of supplement store. But you can swish and swallow with L-glutamine, type of amino acid, and it's safe generally for most people. And it's the same swish and swallow though. And so when you're swishing it, you're really coating every part of your mouth that there could possibly be that skin breakdown that's happening. And when you swallow, then it goes also to the throat, and it can coat the throat, because sometimes you can actually get those sores or ulcers in the throat as well. And then if you're having it more in the mouth, it's helpful to drink those calorie type of drinks or water with a straw. And some people find it helpful to swish and swallow ice water, or swish and spit ice water, or ice with the ice chips there. Sometimes it can help prevent the ulcers from happening, but it can also have a little bit of a numbing effect. And so basically, these ulcers and sores can happen because some medications, chemotherapy specifically, they target fast growing cells, and our skin cells, especially in around our mouth and our throat, they turn over really quickly. But cancer cells also turn over really quickly. That's why it's cancerous, because it's growing, it's multiplying very fast. So it's targeting cells that grow really fast, which also just tends to be our hair, our skin, especially in the mouth and throat. So that's where that can happen sometimes. So you can see that changing the medication can be effective in that sense, but there are ways to also combat if you are experiencing the skin breakdown happening. So again, I can't stress enough how important it is to discuss all symptoms with your oncology team, not even just the mouth sores or change in taste, but any kind of symptom, nausea, diarrhea, anything. Just make sure to talk to your oncology team about that. Don't hide things. They care and they're there for you. And especially if any side effect is really decreasing your quality of life, don't just say, oh, it doesn't matter. Tell them, talk to them about it, let the team know. And like I said before, medications can be switched out to something different that will just have less side effects, but be just as beneficial. And so any side effect that happens can really affect what and how you eat. And that's super important, because what and how you eat is affecting your nutrition status. And having enough micronutrients, calories or energy, protein or amino acids, fat and carbs, everything, it's important to provide energy for your body to function, for you to feel good, as well as to promote healing. And if you're not getting enough nutrition, any of these nutrients, macro or micronutrients, weight loss can happen, and weight loss can delay cancer treatments even. As in, you wouldn't be able, if you lost weight, you wouldn't be able to get the chemotherapy. It can even make healing a little bit more difficult or delayed. And so right now, during the treatment, it's a really good time to focus on nourishing yourself, even especially before treatment, during and after. It's all a good time to focus on really giving yourself some nourishment, treating yourself. Because not only does the food provide nutrients, but it also provides joy. Meal times can be a really nice time, whether you're going to a restaurant, having meals with friends, or just really the taste of the food. It can be really a joyful experience. It's a nice experience. So when you are tasting food, it's a good opportunity to really try practicing mindfulness. So when you eat a meal or you're having a snack, or anytime you're really eating or drinking something, it's a good idea to try to pay attention to the different tastes. It's a nice little practice or activity you can do. Try to say, do you taste sour? Are you tasting sweet? Anything bitter? Where do you know, like, do you notice a certain part of your tongue is tasting it more? Do you notice that it makes you feel a certain way? Is it bringing back certain memories maybe? What are you really experiencing when you're tasting this food? And so with that activity is mindfulness, and we're going to try it together right now. And so we have Janika, who's going to lead the activity for us all right now. So Janika, whenever you are ready, I will.
All right, we are ready. Hi, everyone. Welcome to the CSUN Kitchen. So we're going to walk you through a wonderful sensory evaluation today. But sensory evaluation is a scientific way in measuring and analyzing food by using your senses. So again, your senses are hearing, sight, smell, taste, and touch. So today we're going to go through all of the different flavor profiles. And we do have a special guest with us today. We have Beatrice. She is our student assistant here at the Maryland Magram Center, and she is going to assist in evaluating each of our different flavor profiles. Okay, are you excited, Beatrice? Yes. Okay. All right. So our first one is right here for you. So before you taste it, like I mentioned, a sensory evaluation does include using all of your different senses. So you're gonna take a look at it, you're gonna analyze what the color is, you're gonna smell it, and then you will taste it. All right, so let's start with the color. What do you notice?
It's dark,
Uh-huh.
yes. And if you pick it up with the spoon, it kind of turns a little bit brown.
Okay,
So
okay.
it's like a brown liquid.
Everyone can see that, brown liquid, okay. And what does it smell like?
It smells like something that you will probably put on some food to make it taste better, like kind of gives me like some kind of Asian cuisine.
All right, go ahead and try it.
Yes, that's it. Very salty.
Okay, okay, very nice. Of the flavor profiles, that we kind of know about, so we have umami, we have bitter, we have sour, we have sweet, and we have salty. What category do you think this goes into?
So it was kind of savory as well.
Okay,
So I would say umami.
okay, yes, that's exactly right. So this is soy sauce. So soy sauce is in the category, the flavor profile of umami, which is savory. Other items that are within that flavor profile include your chicken broth, mushrooms are really savory. So anytime you are having any of these flavors, they really cause like your salivary glands to get active, and it really does start the digestion process because it does start with your mouth. Okay, so we're gonna go next. So that is our soy sauce. Wonderful. All right, the next one may be a little easy, but we will have you go through it. All right, so Beatrice, what does it look like?
So it looks like a dark square here. And it has some writing on it. Lindent,
Mm-hmm.
yes.
Okay, and how does it smell?
Oh, it smells so good.
Yeah.
Very good. It smells really sweet. It smells like dessert.
Okay, all right, so go ahead and dive in and taste that. I'm gonna taste it too. Okay.
So it doesn't taste quite as sweet as I imagined.
Mm-hmm.
Yeah.
Okay.
But it does taste like chocolate.
Mm-hmm. It has a good texture, very
Mhm.
smooth texture. Okay.
Yes.
It is definitely chocolate. Do you know what kind of chocolate it is?
Dark chocolate.
Yes, dark chocolate. So I'm gonna put this to the side. Our second one is dark chocolate. Okay. You were right, Beatrice. Wonderful. You are on a roll. So dark chocolate is our bitter flavor. So with dark chocolate, it contains less milk product, less sweetness, and it does really give you that really nice bitter flavor. I love dark chocolate, especially if I want a little bit of sweetness, but not too much because it is very strong flavor. And it will really help with your satiety for your sweet tooth if you do have one. All right, so that one is great. We can just put your piece and my piece to the side. All right, so we have our chocolate there. Okay, so our next one is right in the middle. Okay, so this is our next one. Everyone can see that. All right, Beatrice, how does it look to you?
It looks like a potato that was kind of shaped into being a chip.
Okay, a potato chip.
Yes.
Mhm.
It
And
also
how does it
has-
smell?
Okay, it kind of smells like vinegar.
Okay.
And I would say like lime.
Okay,
Yes. And also I wanted to mention that the color is kind of like beige.
okay. Very nice. All right, let's try it.
All right. Okay.
Ooh,
Mm,
immediately I know what flavor profile that is.
so good.
What flavor profile do you think it is?
Ooh, it's a hard one because it's kind of salty to me.
Okay,
Mm, but
I would say because this one has more of a citrus flavor,
mhm.
that it would be sour.
Oh yeah,
Mhm.
it's sour. Sour is a good one.
Yes, so we have our sour lemon potato chips. So that is our sour category. All right, so let's go to our next one. Let's put that one on the side. Okay,
All right.
so this is our next one. Okay. All right, so what does it look like to you?
So, it looks like it's an orange kind of liquid, viscous, high viscosity liquid.
What's viscosity?
Uh,
Sticky?
yeah, or like the flow of
Okay.
a liquid.
Okay.
It seems like it has high viscosity.
Okay.
And it's orange. So it reminds me of the fruit orange.
Okay,
Could be.
yeah. And how does it smell?
You know, I don't really smell it.
You can pick up the spoon.
Good idea. Okay. Wow, this hard one, because I would say orangey, citrusy.
Okay,
It
okay,
smells like.
okay.
Mhm.
All right, let's try it.
All right.
Cheers.
Cheers. Mm. Okay,
All right,
it's really good.
it is really good. It's very sweet.
Mhm,
It does have that citrus note that you were talking about.
mhm.
I'm looking at it right now and it is like very sticky and viscous as Beatrice described. What do you think it could be? It's actually one of our products.
Mhm. So since you said it's one of our products, I would assume it's orange marmalade.
Yeah,
Mhm.
it is. It is our orange marmalade. So this is really, really excellent. Very sweet. You can include this on a toast. You can put this in a smoothie. It's a great substitution for honey if you like a little bit of sweetness. I have actually tried it in like a citrus tea before, and it works really well. All right. So that is our sweet. The next one we're gonna do is our final category. All right. So this is what we have. Everyone can see that. Okay, so Beatrice, let's start off with the look of it. What does it look like?
Okay, so it's very small and looks like a baby, something very small. So it's green
Mhm.
and kind of reminds me of
Yeah, okay. And what does it smell like?
okay, it's acidic. It reminds me of vinegar. It smells like vinegar, but like it's been marinating in vinegar, exactly.
Okay, okay. All right,
All right.
it is time to taste.
Hey, what it looks like.
Ooh. Whoa, that's a strong flavor.
Mhm.
Whoa. It's hitting all the taste buds.
It really is.
It is.
I really like it.
It's really good, actually. I think it has like more than one flavor in it, but what would be the main flavor?
Since we already did sour,
Mhm.
I would say acidic.
It's salty.
It's salty, of course.
Yes. So pickles, that's what we had, little mini pickles. They are considered salty. They could also be considered sour as well because they're brined in vinegar. But for the most part, your pickles are going to be in your salty category. All right, Beatrice, that is it for our sensory evaluation. Thank you so much for joining
Thank
today. And thank you so much for joining at home. Taste is really, really important when you are focusing on your health and when you are thinking about certain foods. So the next time you think about eating, think about all the various different flavor profiles that you can have. Is it umami? Is it salty? Is it sour? Is it bitter? Is it sweet? And that will really, really help you tap into the deeper flavor profiles of the food that you're eating. Well, thank you, everyone. I hope you enjoyed this, and I'll see you next time.
Thank you so much. That was so fun, so cool. All right. Hope you all enjoyed, and we'll see you next time. Thank you, Janika.
Thank you, Shelley. See you next time.